Hi everyone, I'm Dr. Kate Cam and I'm an aesthetic dermatologist. Today we will be talking about the two most important things that you need to maintain a younger looking healthy skin. This video is part 2 of the 2 videos that I made to cover this topic. If you still haven't watched my first video, you can find it in the link in the description box below. So, what's the second must-have for younger looking skin? It is topical retinoid. You can find it in products that says it's anti-wrinkle or anti-aging as over-the-counter, or you can also get it in strengths that requires prescription. So what are retinoids? They are compounds that are chemically related to vitamin A. So the use of retinoids dates back to the early 1940s when it was used to treat various skin diseases, particularly acne. It was only when those on Tretinoin started to notice that aside from clearing their acne, they also had better skin texture, better skin tone, and also less wrinkles, that the potential for anti-aging of Tretinoin had been discovered. And since then, there's been a lot of studies that they did on retinoids, and it's now the gold standard for the treatment of premature skin aging. To date, there are 4 generations of retinoids. First generation includes tretinoin, retinol, and isotretinoin. Second generation includes etretinate and acetretin. Third generation includes tazarotene and adapalene. And fourth generation includes trifarotene. As you can see, there are lots of retinoids in the market, but we will be talking mostly about topical tretinoin in particular, since tretinoin is the most widely used and studied retinoid to date. For you to understand how tretinoin works, let me first talk about the mechanism of skin aging. So as we age, fibroblasts, which are responsible for the production of collagen and the gel-like substance in the tissues, decreases in number, and not only that, there's also a progressive decline in its responsiveness. This, in addition to other factors like UV exposure, smoking, pollution, etc., leads to decreased collagen in the skin. UV exposure increases oxidative damage and also induces production of collagenases, the enzymes that melts collagen. So since collagen acts like a scaffold to keep your skin plump and healthy looking, decreased collagen leads to the unsightly signs of aging, like wrinkles, sagging, loss of volume, and elasticity. Aging also comes with decreased blood supply to the skin, depriving it of oxygen and nutrients, making the skin look sallow and compromising wound healing. What tretinoin does is that it speeds up the turnover of skin cells, so it speeds up the shedding of dead skin cells and new skin rises to the surface. It also increases the production of collagen in the skin and decreases the rate at which it is degraded. Studies also shows that regular tretinoin use increases blood supply to the skin, giving it that rosy glow, evens out the skin tone, and improves elasticity and hydration. It is also comedolatic, meaning it melts those pore plugs, and pore plugs are precursors to pimples. It is anti-inflammatory, making it a mainstay in the treatment of acne. I usually start to introduce tretinoin to my patients who are in their mid-20s, but if the patient is suffering from acne, then I would go to as young as 13 years old to prescribe it. So with all the good stuff that comes with using tretinoin, you would think, why isn't everyone using it? And it is because the beneficial effects of using tretinoin are seen very slowly. It may even take up to 3 to 4 months before you can see any difference in your skin. Also, first-time users experience irritation, and you need to condition your skin to it, make your skin adjust to it first. Also, it is pretty hard to spread on the skin, so the tendency is for people to use more of the product to cover the entire face. Unfortunately, in this case, more product does not translate to better effects. On the contrary, it just makes the irritation worse. So for tretinoin, less is more. It is very important that you apply it properly and to avoid certain areas in the face, like the eyes, sides of the nose, and corners of the mouth. If you put it anywhere near your eyes, it can dry out your eyes. And also, it can crack the corners of your mouth, so you have to be careful applying it on. So here's a video of me putting on Tretinoin. As you can see, I actually use a little less than a pea-sized amount, and I dab the product all over my face. It is very hard to spread, and if you start rubbing it in right away, you won't have enough for the whole face, so you end up needing more product. Make sure to dab it on first. And again, avoid the corners of your eyes, nose, and mouth. The best thing I can do for my patient for them to stick to using Tretinoin is to manage their expectations. Initially, it will irritate your skin, make it a little red, itchy, and dry. It may even lead to breakouts, but it's normal to experience that for the first 3 weeks. What you can do is to ease in on it, maybe use it every other night, or if your skin still can't tolerate that, start with twice a week application. Then you can gradually increase application until you can tolerate using it every night. There's also varying concentrations available on the market. There's the 0.025%, the 0.05%, and the 0.1%. Usually start my patients first with the 0.05 strength. If you still can't tolerate twice weekly dosing of that, then I suggest that you start with the lowest strength first. I personally almost always advise my patients to use Tretinoin because of all the benefits we can get from it. However, not all of them continue to use it because of the initial irritation they experience or the lack of immediate results. A good number of my patients, though, who follow through with using it regularly really swears by it. Some are even saying it makes them sad that they can't use it a few days before and after certain procedures. Why they can't use it, I'll explain later in this video. Before I make any recommendations, I make sure to interview my patients first to see if they're good candidates to start using Tretinoin. Since using Tretinoin initially makes the skin more sensitive, if my patient is planning to spend a lot of time under the sun in the next 3 weeks, then I would not have them used yet. And that is just to avoid the potential sun damage that may aggravate already sensitive skin. Same can be said for some procedures like laser treatments or chemical peels. I ask my patient to stop using Tretinoin for a few days before and after the procedure. This is again to avoid aggravating the skin before it has healed fully from the procedure. Tretinoin must not be used during pregnancy. This is because the oral counterpart of topical Tretinoin is proven to be teratogenic, meaning it harms your unborn baby. In the decades that we've been using topical Tretinoin, however, there's been no evidence that the topical version can harm your pregnancy. However, it is better to err on a safe side and just ask women to stop using it if they're pregnant. First-time Tretinoin users must be careful about putting on other products on their skin. Do not use any products that can cause skin peeling on top of it unless under the supervision of your dermatologist. And this is to avoid any interactions or increased irritation that can result from using Tretinoin. Also, since Tretinoin can cause skin dryness, use moisturizers, and as I've explained in my other video, sunscreen really is a must. If you are using Tretinoin but not protecting your skin with sunscreens, then you're wasting the benefits you get from the treatment. And if you ask me if I can only use one product on my face, well, of course, aside from a facial cleanser, I would choose sunscreen every single time. Topical Tretinoin is a prescription drug, so you need to see a dermatologist first before you can use it. The over-the-counter counterpart of Tretinoin, which is retinol, is also as good. However, you'd have to wait because it takes a longer time for you to get desired effects from them. You can find retinol in those anti-aging, anti-wrinkle products that promises ageless skin. But if you're planning to use any kind of retinoids, it is always better to consult your dermatologist first in order for them to assess your skin and to make recommendations that are catered to your needs. So there you have it, the two must-haves, sunscreen and tretinoin to maintain that young-looking healthy skin. If you have any questions or comments, or if you have any topics that you'd like for me to talk about, please comment below. And if you like this video, make sure to subscribe to my channel. Thanks for watching!